Greater Manchester is a diverse and dynamic city region in the north of England, made up of 10 localities and 2.8 million citizens. But today, the people of modern Greater Manchester have poor health compared to national and international standards, and people die earlier in some parts compared to others. Health is closely linked with other factors such as money, jobs and housing, which all impact on each other. So poor health is holding back our economy, and a poor economy is holding back good health. We have some fantastic hospitals, care services and universities renowned around the world, but in the past they have often worked separately instead of coming together to really improve local health and well-being. It's said to take an average of 17 years for a discovery, such as a new medicine, to be implemented into the NHS, which is far too long, and we want to make this much shorter here. Devolution is our catalyst for change. In 2016, we became the first place in the country to take charge of our £6 billion healthcare budget and be granted powers to make decisions about how best to meet the needs of local people. Leaders from the NHS and councils are now united in improving local health and well-being. We recognise that we need to do things differently, leading to the creation of Health Innovation Manchester in October 2017. We have brought together our fantastic researchers and innovators from across Greater Manchester to drive improvements forward at a quicker pace. We have merged the Greater Manchester Academic Health Science Network with the Manchester Academic Health Science Centre to create one unified academic health science and innovation system. At Health Innovation Manchester, we recognise that delivering better outcomes for local citizens requires a mindset shift to place people squarely at the heart of everything we do and work effectively across existing organisational boundaries. We are now on our way to becoming the first fully joined-up innovation system in the world, making shared decisions for local people and driving rapid improvements through research and innovation. We want to ensure people start well, live well and age well, regardless of where they live. We have a lot to be proud of, from our airport, fantastic civic leadership and community spirit, thriving businesses, exceptional universities and a devolved health sector boasting some of the best places to receive treatment in the NHS, not to mention our world-class football clubs and tourist attractions. This makes Greater Manchester a place where people want to live and businesses want to invest. We are one big system working together to transform people's health and well-being. At Health Innovation Manchester, our job is to discover, develop and deploy new innovations, which could be a new medicine, new technology, a new way of working, or a digital solution. The opportunities are endless. As an organisation, we have identified 5 key aims and called out a number of things we need to do to achieve these, including working differently with businesses and industry, as well as engaging more effectively with our local doctors, nurses and other professionals working on the front line. Because there are so many possible innovations, we need to prioritise the things that best fit with local people's needs, and we need to speed up the time it takes for these innovations to be implemented. We work with the NHS, councils, other care providers and industry. We provide staff with the skills and knowledge to be able to adopt the change, be it how to administer a new medication, use new equipment, or use a mobile phone app, and we support our local innovative businesses. It is also important that we learn from innovation and continually improve how we do things. Underpinning all of this is digital, which is radically improving how we provide care both now and in the future, including giving clinicians and patients access to up-to-date medical information through a shared care record for all 2.8 million people. Having this data also means we will be able to conduct more world-leading research to test the effectiveness of new innovations. Digital is a game changer for the future, and we will continue to lead the way. The benefits of our innovations can be shared nationally, meaning better outcomes for patients across the country and savings to the NHS and care budget. So all of this together makes Greater Manchester one of the most exciting places to be, whether you live, work or study here. To get involved, visit healthinnovationmanchester.com or tweet @healthinnovmcr.